Hello everyone, how are you? This is Dr. Ken Redcross. I hope all is well. We are doing a special series that I call Bonding with Your Blood Work or Your Labs. As you know, I'm the bond guy. Patient-doctor relationship bonds, the most important thing in healthcare. If you don't know, now you know. So this is important. So we are bonding with our blood results because I don't get for the life of me why we're in medical care and you get these lab tests and it's great because you get the portal now, so they're there instantaneously and you get it, and guess what? It's great. You look at the lab test, you're like, oh great, thank you for my labs, and you see this is high, this is low, you see this is red, some things are green. You're kind of like, so am I going to be here a little bit longer? Like, what's going on in this world? Am I going to be here? So the point of this whole series is just to make sure you feel two things in particular. I want to make sure you feel educated, and this other one's even more important, empowered. I want all of you to feel as important as you are to me today, for us to talk back and forth and for you to care about what I have to say. But in this healthcare world, you may not feel like it, but once again, you're the gold and the platinum of this healthcare behemoth that we're all in, or else it doesn't work without you. And so I want all of you to feel very proud as a patient. I want all of you to feel like, you know, I am a very important part of this thing. And so therefore, those who have the gifts and the blessings to be able to use our brain and knowledge to make you better, that we get there and we're able to come together and be very proud of what I do. And I want you to be very proud of what you do, which is almost in a sense getting your patient on, right? Getting your top flight patient on. And the only way you get your patient on is to make sure that you're educated. And after the education comes the empowerment. So what we've done is we've talked about some very important labs that you get most times when you're leaving the emergency room or going to an urgent care or coming back from anywhere. These blood tests that are all over, but unless you're in the healthcare industry, do you really know what it means? Do you really know what it says about your current health situation or why you went there? Well, my bet, and I'm not a betting man, but my bet only in this case is that you may not. You may not, but that's okay. You're not supposed to. That's why I'm here and why I wear this white coat. So you know. And so the important thing here is that a lot of the blood tests I've talked about are ones that you're going to get routinely. Another one we talked about recently isn't one that's necessarily routine, but it's important. This is another one that isn't necessarily a routine exam you get when you go into the doctor, but it's something that's important at some point in your relationship with your doctor, once a year at least, and depending on your health situation, maybe a little bit more. So as we look at a real lab test and real results here, this particular test, drum roll please, the TSH. What is that, everyone? Does anyone know that? We're going to educate today. This is the thyroid test. Thyroid Stimulating Hormone is what it stands for, okay? So this is about your thyroid. Now, the reason why I said this is an important test, you don't always get it. Obviously, you go to the ER, you came down with the flu, you got in, you got an IV. They're not going to check your TSH, right? Why? No real kind of reason for that, right? But if you go in and you have some of these other symptoms that are going on, then the thyroid becomes important. But I'm hitting on it because it's common, more common than you can believe. It's something that can affect so many of us. It's something that if we know the signs and the symptoms, can make our lives better, quicker, without going through this. So as we talk about the thyroid, everyone, the thyroid is insanely important, right? It comes, we have a receptor in the brain, it comes, it gets released, it goes to the thyroid gland, and the thyroid gland makes thyroid hormone. Now, if you have followed me, you know that when we're talking about things in healthcare, lots of times things are hypo, meaning too little, or they're hyper, meaning too much. Same thing with the thyroid. So the thyroid is such an important hormone. So what happens if a patient comes to my office with hypothyroid? And I want you to listen here, because now that you know what the TSH is, and I should say here the range is 0.27 to 4.2. Interesting, this patient is 5.0, so therefore a little bit elevated. We can chat about that as well and where I stand on that. But once again, in healthcare, in medicine, when I'm looking at things are either hypo or hyper or right where they need to be. So if I have a patient in front of me, what are some things that are going to make me decide, doc, you should probably get a TSH and check on this patient? Well, some of the signs and symptoms are pretty common. What about fatigue? How many times I should say, have a lot of you out there been fatigued? But not just how I had a hard day of work today, but I mean like crazy fatigue. Like, look, this has been going on for weeks, months. I just don't feel myself. What about weight gain? That's something that a lot of my patients, and I think a lot of people in the world, in the United States at least, are familiar when they start to gain a little bit of weight, that thyroid can affect that. So weight gain is something. Not often is it thyroid. Lots of times it's that midnight dessert that you may be taking or lack of exercise. But once again, we're not judging today. Today we are just talking and making sure we educate ourselves on bonding with our blood work. So what about cold intolerance? What about feeling like no matter what, doc, I can't get warm. I don't feel myself, that sort of thing. What about my patients that come in? Some of my, I was going to say female, but some of my male patients as well come in and say, my hair is thinning. Now, can't tell my hair is necessarily thinning, but if you get close, if somebody with my style of hair was losing hair, you would know it. So my point is, I don't have long flowing hair, but some of you do. And so what if that hair is coming out or becoming brittle? That sort of thing. What if your mood has changed and you realize, doc, I have a little bit of fatigue. My hair isn't as thick as it used to be, and I'm feeling down. Depression is something else that can come from hypothyroid. Remember, hypo means what? Not enough, too low, right? That is something that we all want to be cognizant of. Now, when you ask for this TSH test, at some point, one could argue once a year, unless you've already proven to us that your thyroid is out of balance, and that may be checked every 8 to 12 weeks until we get you to where you need to be. It's a lot more common than the hyperthyroidism, okay? Now, hyperthyroidism, what does that look like when I'm talking to patients or what have you? Well, some patients will come in and say, doc, I don't know what's been going on over the past few months. I keep eating and I just can't stop. Like my appetite, I just have a voracious appetite and so forth. And so that's not so much, that's just something. But what if they also pair that with, every so often I get a little flutter. I get a little flutter in the heart and so forth. No chest pain or anything, doc, but I just get a little flutter or a palpitation, right? What if they later say, doc, my GI tract has been a little bit off. I'm starting to get a lot of diarrhea all the time. So I'm having diarrhea. I'm feeling more anxious is something else you can see. So I'm getting diarrhea. I'm feeling more anxious. Over time as a doc, I start to see the patient come in maybe, and I see that the eyes are bulging a little bit more because the eye muscles with increased thyroid can start to grow a bit and cause them to bulge a bit as well. So the point is, as you get this blood test, the whole point of what we're talking about with bonding with our blood test is how can we bond with our body, our soul, our own spirits by having some increased education so that you can feel that empowerment that I want all of you to feel. Now, when you're dealing with low thyroid, it's treated a little bit different because when something is low, you can think you need supplementation with that, right? You're going to likely need some thyroid hormone back because as you can see, if it's low, who wants to deal with the fatigue? Who wants to deal with the weight gain? Who wants to deal with the thinning hair? Who wants to deal with those challenges? So you want that back in. On the flip side, what about those who have the high thyroid, right? The ones who feel anxious, the ones who have the palpitations, the ones who have diarrhea. Those are symptoms that you really don't want as well, but you don't need supplementation for that, right? Because you got too much. So we do other things in healthcare. We do things, whether it be through radiation with the pill use or what have you, whatever the cause is, but we try to bring that down. We try to tamp down that thyroid so that it doesn't overwork. It's like it's overworking for your things. The other thing to keep in mind too, and why I need you to understand this, is lots of times there's reasons for them that we need to address, right? A hypothyroid, like I said, is or the low one. Remember, hypo is low, hyper is high. Things that we can do. There are some common causes that luckily are pretty darn benign that make it lower. There's also some causes that for high thyroid that are still pretty benign if we kind of catch them early and make sure that we're doing something. And honestly, even if hyperthyroid, you catch it a little bit later, don't worry. There's always something that we can do to improve your quality of life. And so the important thing to take away from our bonding with labs as we talk about which one checks the thyroid again, I'm becoming forgetful. It's a way for me to quiz you. Which one do we check the thyroid with? Does someone say TSH? Now you get a gold star. Put it right there on the screen for you. TSH, Thyroid Stimulating Hormone, is the way that we check the thyroid. So when you are thinking of ways you don't feel yourself, you feel things are off a bit, if you haven't had one in a while, ask your doctor about it, because now you are armed with knowledge. You know the symptoms that you may feel if it's low. You could say, Doc, I've had some fatigue, some weight gain, I have cold intolerance. Those are things I need to share. My mood is down. On the flip side, you could say, Doc, I'm having some palpitations. I feel nervous. My stomach is queasy quite often. It's been going on a while. The point is, when you give that extra information for the doctor, not only does it necessarily make my job easier, but the important thing, it allows me to get to work. It allows me to say, oh my gosh, these are what we call pathognomonic, meaning perfect for what we learned in school, those classic symptoms. It allows us to get to work and get you feeling better sooner because you're now educated. But the big take home is that you're also empowered. And that's the way I want all of you to feel. I always say I want you to feel like what? Gold and platinum. Both of those are pretty precious metals. And you're that precious to me, and I'm sure you're that precious to your docs as well. So once again, I hope this has been helpful. If it's really, really helpful, by all means, like, subscribe, send it to someone. Let's all stay healthy together. Talk to you soon. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore, I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.